You know your body. You feel something's off, but then your MRI or your X-ray comes back clean and suddenly the conversation ends. Maybe you're told just give it time. Maybe you're left wondering if you're making it up. Here's the problem. Imaging is a tool, not the whole truth. Many midlife conditions don't show up clearly on MRI. Frozen shoulder, perimenopause-related joint pain, low-grade inflammation, they're often invisible on scans, but invisible does not mean imaginary. Here's an interesting fact. Up to 40% of women who present with frozen shoulder have completely normal imaging, and yet the pain is real, function is limited, and the absence of findings on a scan doesn't erase the reality of what you're experiencing. This is where the system often fails. Too many clinicians treat imaging like the final word. But what about your lived experience? What about the fact that you can't lift your arm to wash your hair, or that every night you wake up with searing pain? That matters more than the pixels on a screen. Here's a helpful tip. If your imaging is clean but your pain persists, shift the question from what did the MRI show to what functional diagnosis explains my symptoms. In other words, stop focusing only on the picture and start focusing on how your body is actually working. That's where the answers live. So if you've ever been told your MRI is normal, you're fine, don't stop there. Find a clinician who listens, who validates what you know about your body, and who can offer solutions even when the scan doesn't tell the whole story.